Human papillomavirus, commonly known as HPV, is one of the most widespread sexually transmitted infections in the world. While much of the public conversation about HPV centers on women, particularly due to its strong link to cervical cancer, men are equally susceptible to this virus and can experience a range of symptoms, or none at all. Understanding what HPV looks like on a man is essential for sexual health, early detection, and prevention of potential complications. HPV is not a single virus, but rather a group of more than 200 related viruses. Each of these viruses, or strains, can cause different symptoms and affect individuals in various ways. Some strains are considered low risk, mostly causing warts, while others are high risk and associated with certain types of cancers, such as penile, anal, and throat cancers. For many men, HPV infection does not cause any noticeable symptoms. The body's immune system often clears the virus naturally within 2 years. However, some men will develop physical signs, and recognizing these can be important for both personal health and the health of their partners. One of the most common visible signs of HPV infection in men is the development of genital warts. These warts can appear anytime from weeks to months after exposure to the virus, though in some cases they may not show up for years. Genital warts caused by HPV typically appear as small growths or lumps on the genital area, including the penis, scrotum, groin, thighs, or around the anus. The appearance of these warts can vary significantly. Some warts are small and flesh-colored, while others might be grayish. They may present as single bumps or appear in clusters, sometimes resembling the shape of a cauliflower due to their rough, uneven surface. The warts can be raised or flat, large or small, and they are usually painless, though some men may experience itching, discomfort, or mild bleeding if the warts are irritated or injured. On the head of the penis, warts may be more noticeable, often standing out against the surrounding skin. On the shaft or base of the penis, warts may be subtle, blending in with natural skin textures. Around the scrotum and groin, they may be mistaken for other benign skin growths, such as skin tags. When warts appear around the anus, regardless of whether a man has engaged in receptive anal intercourse, they can be more difficult to see and may go unnoticed for a long time. It's important to note that not every bump or irregularity in the genital area is caused by HPV. Other conditions, such as molluscum contagiosum, pearly penile papules, or even ingrown hairs, can mimic the appearance of genital warts. This is why it is crucial for men to seek a medical evaluation if they notice any new or unusual growths, lumps, or skin changes in their genital region. While genital warts are the most recognizable sign of HPV infection in men, most strains of HPV do not cause visible symptoms. High-risk strains, which are associated with cancer, rarely produce warts or other outward signs. Instead, these strains can cause changes in the cells of the penis, anus, throat, or mouth. These cellular changes are not visible to the naked eye and are typically detected only through medical screening, such as a biopsy or specialized tests. In rare cases, persistent HPV infection in men can lead to precancerous lesions or cancer. Penile cancer, for example, may start as a flat, red area or a sore on the penis that does not heal. Similarly, anal cancer can begin as changes in the skin around the anus, such as lumps, bleeding, or pain. But these symptoms are not exclusive to HPV and can result from other causes as well. Oral HPV infection is another concern for men, especially those who engage in oral sex. Most oral HPV infections do not cause symptoms, but some may lead to warts in the mouth or throat. These warts can appear as small, raised bumps on the tongue, gums, palate, or throat, but they are rarely seen or felt, and often only discovered during dental examinations. Given that most HPV infections are asymptomatic, many men who have the virus are unaware of their status. They can, however, still transmit the virus to their partners through sexual contact, including vaginal, anal, or oral sex, even if they do not have visible warts or other signs. The question of what HPV looks like on a man, therefore, has a complex answer. In most cases, it looks like nothing at all, there are no visible symptoms. When symptoms do appear, the most common sign is genital warts, which can vary in appearance but are typically small, flesh-colored, or grayish growths on the genital or anal area. Rarely, HPV may cause changes that eventually lead to cancer, but these changes are not visible without medical examination and testing. Because of the potential for asymptomatic transmission, regular communication with sexual partners and routine health checkups are important. Men who notice any unusual growths, sores, or changes in their genital or anal area should consult a healthcare provider for evaluation. Early detection and treatment of genital warts can prevent them from spreading and alleviate discomfort. Additionally, while there is currently no approved routine HPV screening test for men, those who are at higher risk, such as men who have sex with men or men with HIV, may be offered anal pap tests to screen for early signs of anal cancer. Prevention remains a cornerstone of HPV management in men. The HPV vaccine, which is safe and effective, can protect against the most common cancer-causing and wart-causing strains of the virus. The vaccine is recommended for boys and young men, ideally before they become sexually active, but it can also be given to older men under certain circumstances. Condom use can reduce, but not eliminate, the risk of HPV transmission, as the virus can infect areas not covered by a condom. In summary, HPV in men most commonly presents as genital warts, which are small, flesh-colored, or grayish bumps appearing on or around the penis, scrotum, groin, thighs, or anus. These warts may be solitary or clustered and can be flat or raised. However, the majority of HPV infections in men cause no visible symptoms at all, making it easy for the virus to be unknowingly passed to others. High-risk HPV strains can lead to cancers but do not typically produce visible signs. Because of this, men should be vigilant about any new or unusual changes in their genital or anal region, and seek medical advice if they have concerns. Regular healthcare visits, open conversations with partners, and preventive measures like vaccination and condom use are key steps in reducing the impact of HPV. Understanding the subtle and often invisible nature of HPV in men is important, not only for individual health, but also for protecting partners and reducing the overall prevalence of this common virus.